Welcome to our new section, which is the imaging anatomy of the thorax. We have finished the imaging anatomy of the brain and head and neck, and it was a difficult part, right? So we are going to the lovely part, the chest. Why it's lovely? Because it has this, right? Okay. So the outline of the thorax section will include all of these. We will start with the cardiovascular system, including the mediastinum, the pericardium, and lymph node groups, which we will discuss today. Then we will move on to cover this outline in the coming lectures. So let's start with the mediastinum. We know from medical school that mediastinum is the space at the center of the thorax, right? Between the two lungs, and it is bounded by the sternum anteriorly and the vertebral column posteriorly. It contains all of these structures: the heart, the great blood vessels, the esophagus, the trachea, the phrenic nerves, the cardiac nerves, the thoracic duct, thymus, and mediastinal lymph nodes. We will not cover all of them today because some of them belong to cardiovascular system, some of them belong to bronchopulmonary system. So we will cover the ones that are very specific to the mediastinum. And we will focus on the subdivisions of the mediastinum, because it's important in the medical imaging life that you know what are the structures in a specific space. So we know what are the differentials when there is a pathology at this certain area. We have this beautiful illustration from Gray's Anatomy, which shows the location of the mediastinum at the center of the thorax. Anteriorly, there is the sternum. Posteriorly, there is the vertebral column, and on either side there is the pleural cavities and the lungs inside them. This is a sagittal view showing the almost all the borders of the mediastinum. So superiorly there are the clavicles and the superior thoracic inlet, anteriorly the sternum, posteriorly the vertebral column, and inferiorly the diaphragm. So all of this space is the mediastinum. But mediastinum is then subdivided into several spaces in relation to the pericardium and the thoracic plane. We will know what is the thoracic plane shortly. It's also called the plane of Ludwig. So the superior mediastinum is the space or the part of the mediastinum above the upper level of the pericardium and plane of Ludwig, and the inferior mediastinum is below this plane. Then the inferior mediastinum is divided in relation to the pericardium into anterior, which is anterior to the pericardium, middle, which is contained within the pericardium, and posterior, which is posterior to the pericardium. This illustration here illustrates the subdivisions of the mediastinum. So this is almost the level of the thoracic plane. Superior to this plane is the superior mediastinum, and inferior to this is the inferior mediastinum. And then the inferior mediastinum is divided by the pericardium into anterior, middle, and posterior mediastinum. We will know shortly the structures that are contained within each of these spaces. This is a sagittal CT image annotated to show all of these subdivisions. So this is the thoracic inlet, which is the upper border of the mediastinum, and the diaphragm, which is the lower border. This is the thoracic plane, extending from the lower border of the manubrium of sternum to the lower border of T4. Yeah, so this is the thoracic plane. Superior to it is the superior mediastinum. Inferiorly is the inferior mediastinum. Then, in relation to the pericardium, we have the anterior mediastinum, the middle mediastinum, and the posterior mediastinum. So, as we said, the thoracic plane is extending from the lower border of manubrium of sternum to the lower border of T4. So, it is an artificial horizontal plane. It's not a real plane, but we just use it to divide the mediastinum into these subdivisions. There are several important structures that are transected by this plane, and this mnemonics is used to remember these structures. The mnemonics is red. The claptra. So the C is for the cardiac plexus. Cardiac plexus is a nerve plexus formed by the branches from sympathetic and parasympathetic nervous system. And L for the ligamentum arteriosum. The ligamentum arteriosum is the remnant of ductus arteriosus, which is the duct that is patent in the embryologic age. And then after birth, it then occlude and form this ligament, which is connecting the aortic arch to the left pulmonary artery. The A is for the aortic arch, particularly the inner concavity of the aortic arch. The P is for the pulmonary trunk. The T for the tracheal bifurcation, which is called the carina. The R for the thoracic duct, which is extending from right to left and located posterior to the esophagus. The A for the esophagus vein, draining into the SVC, the superior vena cava. And the P for the prevertebral fascia and pretracheal fascia ends. So all of these structures are transected by the thoracic plexus. So some of these structures will be contained within the superior mediastinum. Some of them will be included within, like some parts of them, the lower parts of them will be included within the inferior mediastinum. We move on to study the contents of each of these spaces. So starting with the superior mediastinum, it contains several organs and structures. The muscles that are originating from this area include the sternohyoid, the sternothyroid, and the lower end of longus colli muscles. We studied these muscles when we talked about the neck muscles. The arteries include the aortic arch and the great blood vessels. The veins include the right and left brachiocephalic veins, the left superior intercostal vein, and the upper half of the superior vena cava. And then the lower half will be included in the inferior mediastinum. The nerves, including the phrenic nerves, the vagus nerves, the cardiac nerves, the cardiac plexus, the left recurrent laryngeal nerve. The lymph nodes, it has several lymph nodes. We will have a separate section for the lymph node. Then the trachea, the esophagus, the thoracic duct, which is the major lymphatic vessel in the body. It passes through the posterior portion of the superior mediastinum, posterior to the esophagus and anterior to the vertebral canal. The thymus and some other structures, including some branches of blood vessels and nerves. So this is another illustration which shows the structures that are included within the superior mediastinum. So let's review the borders of the superior mediastinum. It's extending from the superior thoracic inlet, right, to manubrium, right? Yeah, antiphon. So this is the angle of Lewis, right? Yeah, which is the lower border of the manubrium sternum, and this is the thoracic onlet. So within this space is the superior mediastinum. It includes all of these structures that we see here, which are overlapping with the thoracic cage. These great blood vessels, the trachea, the esophagus, and some other nerves and thoracic duct, which are not shown here. This is another illustration for the superior mediastinum with the thymus being removed. We will see the thymus shortly. So here we see these great blood vessels that are coming out from the heart, the trachea, the esophagus, the vagus nerves. This is a sagittal illustration showing the intercostal veins, which are these veins within the intercostal spaces, and then they are draining into the brachiocephalic vein. We will talk about the esophagus and hemiesophagus system in the coming lectures. And then we have the phrenic nerve, the vagus nerve here. This is a coronal illustration. So this is almost all the structures of the mediastinum. So the superior mediastinum include these structures until almost here, because it's passing through the ligamentum arteriosum, which is this structure here. and the aortic arch and pulmonary trunk. So superior to this is the superior mediastinum, and inferior to is the inferior mediastinum. Here we almost see the pericardium and the heart, which are included in the middle mediastinum. We can also see the left phrenic nerves on either sides, and some branches of pericardiacophrenic vessels. This is an axial CT scan with the corresponding diagram, which illustrates these structures within the superior mediastinum. So here we have the branches of the aorta from left to side, the left subclavian, the left common carotid, and the brachiocephalic artery. On the other side, we have the right brachiocephalic vein. Then we have this air-filled structure, which is the trachea, right? And posterior to it, these small structures, sometimes it's collapsed, sometimes we can see some air within it, which is the esophagus. So these structures are included within the superior mediastinum. There is also the thymus. We will talk about the thymus shortly. We will know the normal density of it in children and in adults. And there are also some other structures that are not easily identified on images, including the recurrent laryngeal nerves, the vagus nerves, the phrenic nerve, the thoracic duct. So they are also included within this space, but if they are normal, sometimes they cannot be identified. This is a more caudal section. Here we can see the arch of the aorta and the superior vena cava. Anterior to that is the thymus here. And here is the esophagus, the trachea, the arch of the esophagus vein. Other small structures include the thoracic duct, the recurrent laryngeal nerve, the vagus nerve, phrenic nerve, are also included within this space. Let's talk about the thymus. The thymus is the most anterior component of the superior mediastinum. So when we see a pathology of the superior mediastinum, especially at the most anterior part, we should think of the pathologies of thymus gland. It lies immediately posterior to the manubrium of the sternum, and anatomically it has two lobes, but they are asymmetric. It can extend superiorly, can reach the neck as high as the thyroid gland, and it can extend inferiorly into the anterior mediastinum over the pericardial sac. We know that the thymus is involved in the immune defense, right? So it is involved in the early development of the immune system in children, but then after puberty it begins to atrophy and shows considerable size variations in adults. Normally in the adults it will be replaced by fat tissue. So what will has like the density on CT and the signal intensity of MRI will be corresponding to the fat contents of it. So it will has hypodensity on CT, and it will has chemical shift on MR sequences between in phase and out of phase images. So this is an illustration of the thymus. Two lobes, almost transected by the thoracic plane. These two lobes are not symmetric. We should know the normal size of it in children and in adults. We said that it's large in children, right? Because it's involved in the development of immune system. But in adults, it's atrophied. So when we see this configuration in small kid, we should know that this is normal. So this is a normal thymus, which has this triangular cell, or called the thymic cell sign. In this case, it's slightly deviated toward the right mediastinum, but it's still considered normal. And this is an axial CT image for a 12 years old child, showing a normal thymus. As we said, it's the most anterior portion of the superior mediastinum. So it's almost posterior to the manubrium of sternum. If you notice that the density is not that much high as the soft tissue, right, the muscles, and is not that much low as the fat. This is the subcutaneous fat, right? It's in between. Yeah, because now it's almost within the phase of being changed or being replaced by the fat tissue. Yeah. The variations of thymus including variable locations and variable shape. We knew the normal location. So the variable location, that it can be located anywhere along the path of the descent of the thymopharyngeal duct. For example, retrocaval, posterior to the vena cava, cervical, and posterior mediastinum. So we should be aware of this, because sometimes I saw one case where it was migrated into the neck. So the kid was presenting with a neck mass. Yeah. Then when they did MR image, they found that it is just a normal thymus. So these locations are some variable locations of the thymus. So if it's not found within the normal location and there is like a soft tissue mass elsewhere which has the same characteristics of the thymus gland, we should think of variable location of thymus. Variable shape, it can has a unilobe shape or trilobed or X-shaped or inverted V-shaped. Then we move on to talk about the anterior mediastinum. Where is this space? It's below the thoracic plane, posterior to the sternum, anterior to the pericardium, right? So the contents of this location are not so much. There is only like maybe a portion of the thymus, some lymph nodes. We'll talk about them shortly, and it may contain a portion of retrosternal thyroid if present. Then the medial mediastinum is the space that is contained within the pericardium. So it will contain the pericardium itself, the heart, the great vessels that are joining the heart, including the ascending aorta, the pulmonic trunk, and pulmonary veins, and so on. Lower halves of the superior vena cava. The superior half will be within the superior mediastinum. The tracheal bifurcation, which is the carina, and both main bronchi. Phrenic nerves, cardiac plexus, they are also extending through this space. And the tracheobronchial lymph nodes, we will talk about the lymph nodes in a bit. So this is the illustration that we had just showed previously. So we review here the location and the structures of the middle mediastinum. So we have the pericardium, the heart inside it, and the blood vessels that are joining the heart within this space. The contents of the posterior mediastinum include the descending aorta, the esophagus and hemiesophagus venous system, the esophagus, and several groups of lymph nodes, and the thoracic duct. This is an illustration of the descending aorta and esophagus. So in this image, the anterior and middle and superior mediastinum are removed. So we are left with the posterior mediastinum with some of the structures of posterior mediastinum. We can see the descending aorta, the main bronchi, the esophagus, and branches of the descending aorta. This is the illustration of esophagus system of the veins. We will talk about it in the coming lectures. Here we just need to know that it is located within the posterior mediastinum. This is the thoracic duct, highlighted in green here. So it's located posterior to the esophagus and anterior to the vertebral column. And these are the branches and the trunks of the sympathetic nervous system. Our second part is the pericardium. The pericardium is a conical, flask-like fibroserous sac which contains the heart inside it and the roots of the great blood vessels, and it defines the middle mediastinum from the anterior and posterior mediastinum. So In real, it has two sacs, not just one. It is the fibrous pericardium and the serous pericardium. The fibrous pericardium is the most outer layer, which is made of fibrous tissue. And then there is a double layered serous pericardium. These layers are the parietal and visceral. The parietal is the one that is attached to the fibrous pericardium, and the visceral is the one that is attached to the myocardium, to the heart. The two layers of the serous pericardium are divided by the pericardial space, which normally contains about 15 to 50 milliliter of serous fluid. This is the fluid that helps to lubricate and facilitate the movement of the heart. So a minimal fluid within the pericardial cavity is normal. But when there is a lot of fluid accumulation here, it's then becoming a pathology. This is an illustration of the pericardium. So the fibrous pericardium is the one that is highlighted in blue-green, I think, this color. Yeah. Then these two double layered sac is the serous pericardium. The outer one is the parietal layer, and the inner one is the visceral layer. The space highlighted in black is the pericardial cavity containing the serous fluid, pericardial fluid. The pericardium has several reflections around the blood vessels. These reflections form some structures which are called sinuses and recesses. We need to be aware of these structures so we do not confuse them with the pathologies. They are mainly two sinuses, the oblique sinus and the transverse sinus. The oblique sinus is formed by the superior and inferior vena cava and the four pulmonary veins. Let's see this. So this is the oblique pericardial sinus. This is the superior vena cava, inferior vena cava, and the four pulmonary veins. So the reflection of the pericardium along these veins is forming what is called the oblique pericardial sinus. So this is the oblique pericardial sinus. So we will see the recesses that make this structure. Yeah. We need to be aware of this so we don't mistake it with esophageal mass or bronchogenic cysts, because they are coming at this location. Especially the bronchogenic cyst, because it has the same density and the same intensity. Okay. Then there is the transverse sinus. This one lies between the aorta and pulmonary artery anteriorly and the atria posteriorly surrounding the ascending aorta. So this is the transverse sinus surrounding the pulmonary trunk, pulmonary arteries, and the ascending aorta here. This reflection. There are several recesses that may be mistaken for dissection or lymphadenopathy, including the superior aortic recess, the right and left pulmonic recesses, and the post-caval recess, the recess posterior to the vena cava. Let's have a look to this axial CT image. So this thin sheet-like isodense structure is the pericardium. So this is the pericardium. Minimal fluid within the pericardium is normal. This is a portion of the transverse pericardium here. So this is not any pathology. Then we have a look to this image. This is a normal cross-section CT. In A, we see the ascending aorta, descending aorta, main pulmonary artery, right pulmonary artery, and the superior vena cava. Anterior to the ascending aorta is the superior aortic recess. On the right side, it's called the right superior aortic recess, and anteriorly is the anterior supraaortic recess. So when we lose these recesses, it means that there is a pathology with the pericardium. We will see a case shortly. When these recesses are enlarged, expanded, there is the pericardial effusion. So, as you see here in this image here the right superior aortic recess is expanded, right? It's larger than normal. So there is a pericardial effusion here. Then along the pulmonary trunk we have the pulmonic recess. So here we can see the left pulmonic recesses. Then we have the posterior pericardial recesses here, posteriorly. The blood supply to the pericardium is mainly from the internal thoracic artery and its branches, and some branches from the descending thoracic aorta. Then the venous drainage is to the pericardiacophrenic veins. The innervations is by the phrenic nerves to the fibrous and parietal serous layers, the vagus nerve, and the sympathetic trunks, which are responsible for the pain, for the innervation of muscles and vessels of the heart. So, have a look to this image and tell me what's wrong with this heart. Do you see any abnormality?
It is enlarged.
Is it enlarged?
Enlarged or deviated to the right.
Or deviated, yeah.
Because I don't see the right, clearly I don't see the right atrium.
Yes. So there is loss of right cardiac border, right? There is the left deviation of the heart. And if you notice, there is this radiolucency here between the heart and the left hemidiaphragm. Usually the heart is lying on the hemidiaphragm. So we do not see this radiolucency, this air containing structure. So this is a case of, okay, before I say what is wrong with this one, we'll see the CT. But truly, yeah, there is liver position and there is radiolucency between the inferior cardiac border and the left hemidiaphragm.
The window, now I see it. The aortic valve.
Yeah. Yeah. Then have a look to this CT scan of the same patient. You saw anything? So it's fast?
Once more.
Okay. So is the normal location of the heart?
No.
This is the sternum, right? Yeah. Usually the heart should lie posterior to the sternum, within the middle. Yeah, it's deviated to the left side. Yeah, true. So there is a liver position of the heart. This is first. Second, the apex of the heart, which is the most lower end of the left ventricle, is lying posteriorly. So there is posterior location of the apex. And finally, if you notice, have a look again. What are we supposed to see here? We saw in a previous image there was a recess there, right? It was filled with fluid, which is the anterior superior aortic recess. Here, what we see is a tongue-like structure extending from the lung, which is air-filled here. So there is a loss of this recess. So this is a case of pericardial agenesis.
How about the dimension of
here we are focusing on this pathology. So second we cannot measure here. Yeah. So yeah, there is a liver position. There is loss of right cardiac border on the X-ray images. Sometimes you can see the radiolucency between the inferior border of the heart and the left hemidiaphragm. On the CT and MRI, there is also MRI image here. This is sign. Yeah. So this is liver position and posteriorly located apex. And there is the tongue-like tissue that is extending between the aorta and pulmonary artery. This is because of the loss of pericardium here. But this is not a complete pericardial agenesis. Let's have a look again to this image. Yeah, there is a slight portion here that lies on the right atrium, which is still preserved. So this is near complete pericardial agenesis, but it's not complete. It can be divided into partial and complete. So we should be aware of pericardial agenesis. This is one of the normal variations. Then we move on to our last part of this lecture, which is the lymph node groups. Here you need to add more focus. Yeah, and to be more concentrated. Because lymph node groups of the chest, particularly the mediastinum, is one of the most important lymph node groups in the body because they are related to the staging of lung cancer and other pathologies of the chest and mediastinum. So here we are using the classification of the International Association for the Study of Lung Cancer that was posted in 2009. It divided the mediastinal lymph nodes into these groups, and each of these groups has several stations. So we have the supraclavicular nodes, the superior and inferior mediastinal nodes, the aortic nodes, and then the hilar, lobar, and subsegmental nodes. This is an illustration of all of these nodes. The ones that have the number 1 are the supraclavicular nodes, so they are superior to the clavicle. Then 2 to 4, 2, 3, and 4. 3 is prevascular because they are anterior to the blood vessels, so they are not shown in this image because the blood vessels, the anterior part of the blood vessels are removed. So 2, 3, and 4 are the superior mediastinal lymph nodes.
So we have 2 right and 2 left.
Yeah, we'll talk about each of these shortly. Yeah. Now we have a general overview of all of these lymph nodes. Then 5 and 6 are the aortic nodes. Then 7, 8, and 9 are the inferior mediastinal. So the superior mediastinal lymph nodes are the one above the carina, and the inferior mediastinal lymph nodes are the one below the carina. Then 10 is the hilar, and 11 to 14 are the subsegmental lymph nodes. So we will talk about the specific lymph node stations one by one, starting from the supraclavicular zone nodes. If you remember, we talked about the lymph node groups of the neck, right? And we said that the last one is extending to the lower margin of the cricoid cartilage. So from the lower margin of the cricoid cartilage, inferiorly, is the supraclavicular lymph nodes. Then the upper border is the lower margin of the cricoid. The lower border, is the clavicle and the upper border of manubrium. And then anteriorly they are divided by the midline into left and right groups. We are okay with this group, right? Let's have a look again to this illustration. This is the same illustration, but here it's magnified on this portion. So these are the supraclavicular lymph nodes below the cricoid cartilage and above the clavicles and manubrium of sternum, right? By midline, they can be divided into left and right. The second station is the right upper paratracheal. We will find that the paratracheal lymph nodes are divided into upper and lower, and then each of them are divided into left and right, because there is a slight asymmetry between the two sides. For example, here we have the right upper paratracheal. The upper border of them is the upper border of the manubrium. This is the same for the left upper paratracheal, but the lower border is different. The lower border for the right upper paratracheal lymph nodes is the intersection of caudal margin of innominate vein, which is the left brachiocephalic vein, with the trachea. But the lower border for the left paratracheal left upper paratracheal lymph nodes is the superior border of the aortic arch. Let's have a look to this illustration. So these ones that are numbered 2 are the upper paratracheal lymph nodes. They are divided by a midline into left and right. The superior margin is the same, but the inferior margin is different. For the right, the inferior margin is the lower margin of left brachiocephalic vein. But for the left one, they are slightly more lower. Yeah, it's the superior border of the aortic arch. Let's have a look to this image. So this is axial CT image with some enlarged lymph nodes. So here we have this lymph node. This is anterior to the trachea, right? And posterior to the branches of the aorta. So this is considered paratracheal zone nodes. Here it's at the midline, so we cannot differentiate into left and right. So this is paratracheal lymph node. Actually, if you have a lot of confusion about the paratracheal lymph nodes, upper and lower, left and right sometimes, you can just name it the paratracheal lymph node. The 3 station, we didn't talk about it yet, so we will leave it for the next one. So the 3rd station is the prevascular and prevertebral lymph nodes or paravertebral lymph nodes. They are either anterior to the blood vessels, so they are called prevascular, yeah, or behind the esophagus, so they are called prevertebral or paravertebral. Practically, we need to know that these lymph nodes, the lymph nodes of the 3rd station here, are not accessible by the mediastinoscopy. But the 3P, which are the prevertebral lymph nodes, can be accessible by the endoscopic ultrasound. Yeah. So let's have a look to these ones. I think these ones are clear because they are slightly more far from the center. Yeah. So 3A are anterior to the blood vessels, which means anterior to the aorta and superior to the cava and so on. Yeah. And the 3P, the prevertebral and paravertebral, are posterior to esophagus and anterior and surrounding the vertebral bodies. Let's have a look here. Where is this lymph node? True. What is this? Banana-like structure. Yeah, aortic arch. Cross-section of aortic arch. Then this is the superior vena cava. And this hypodense structure here is the atrophied thymus. Yeah. Yeah. So anterior to blood vessels is the prevascular lymph node. This is easy to know. This one again. Anterior to the blood vessels, right? Yeah. So this is prevascular. So the most anterior ones are the prevascular. The 4th station are the lower paratrachea. We talked about 2nd station at the upper paratrachea. So the lower ones are the lower paratracheas. They are also divided by midline into right and left. The right ones bordered superiorly by the intersection of caudal margin of innominate vein with the trachea, and lower border is the lower border of esophagus vein. So this is the right lower paratracheal lymph nodes. We knew that the upper ones are ending at the lower margin of left subclavian, left brachiocephalic vein, right? So inferior to that are the lower paratracheal, but they are upper the lower border of esophagus vein. Then have a look to this one. So this is the trachea, right? And this is the superior vena cava. When we see the superior vena cava, it means that we are like inferior to the brachiocephalic vein, right?
Yeah.
So we are not in the upper paratracheal, we are in the lower paratracheal. Yeah, this is how to differentiate between upper paratracheal and lower paratracheal. If you are at the level of the brachiocephalic vein or above, then that's the upper paratracheal. Below the lower margin of left brachiocephalic vein are the lower paratracheal nodes.
And also, just to know that The brachiocephalic veins are the ones that form
the superior vena cava. Yes, true. And because this is to the right, so it's for R. R is for the right. The 4L, the left lower paratracheals. These are located lateral to the left border of the trachea, between a horizontal line drawn tangentially to the upper margin of the aortic arch and a line extending across the left main bronchus at the level of the upper margin of the left upper lobe bronchus. We will see illustrations so we will understand all these. So these include the paratracheal nodes that are located medially to the ligamentum arteriosum, because the ones that are lateral to the ligamentum arteriosum are another station lymph nodes. So these ones are medial to the ligamentum arteriosum. This illustration will explain everything. So between the upper and the lower margins of the aortic arch, medial to the ligamentum arteriosum, and lateral to the left border, the left border of the trachea is the 4L.
So essentially around the aorta.
Around the aorta, medial, because laterally we'll have the 5.
Oh, yes.
Yes, they are around the aorta and around the trachea, like around the aorta medially, around the trachea laterally. Right?
Oh, yeah. Around the trachea.
Laterally on the left side.
Around the trachea.
Yeah. So these are paratracheal. So let's have a look here. This is the trachea, right? This is the ascending aorta. This is the descending aorta. This is the superior vena cava. What is this one? Paratracheal, true. All of them are paratracheal, both this and this. Paratracheal, that's good. Then you need to define upper or lower. What is the landmark?
Low.
Yeah, superior vena cava, lower, yes. If they are at the level of left brachiocephalic vein or above, they are upper. Below, they are lower. Good. So this is lower. Good. Left or right? This is easy.
Right.
Yeah. So divided by midline into right. So on the left side, we have the left. So these are the 4L. This is another one for R, for lower paratracheal lymph nodes, and these are the left lower paratracheal lymph nodes. The fifth station is called the subaortic nodes or the aortopulmonary window. We need to know the aortopulmonary window so we know what is this station. The aortopulmonary window is the window between the aortic arch, which is curved structure, and the pulmonary trunk. So the window between these two structures is the aortopulmonary window. It's a form window. So the lymph nodes that are within this window are called the subaortic or the aortopulmonary window. But we need to know that these lymph nodes are lateral to the ligamentum arteriosum, because the ones that are medial, are 4L, right? Yeah, the left lower paratracheals. Let's have a look at this one, then we come back to the sixth station. So this is the aortic arch, this is the pulmonary trunk. This window here is the aortopulmonary window. The lymph nodes that are within this area, lateral to the ligamentum arteriosum, are the fifth station lymph nodes, or the subaortic, or sometimes they are also called aortopulmonary lymph nodes. The sixth station is the para-aortic lymph nodes. These are anterior and lateral to the ascending aorta and the aortic arch, from the upper margin to the lower margin of the aortic arch. So these are anterior and lateral to the ascending aorta. This is the ascending aorta. Anterior to lateral to it, between the upper and lower margin of the aortic arch, are the sixth station or the para-aortic lymph nodes. Let's have a look at this image. This is the ascending aorta. This is the descending aorta, right?
Yes.
We don't see the pulmonary trunk. which means that we are within the aortopulmonary window. The aortopulmonary window is between the arch and the pulmonary trunk. So here now we are within the window itself. So these are the fifth station, or the subaortic lymph nodes, or the aortopulmonary lymph nodes.
So when you move down
and you see the pulmonary, then you are moving to another part. 3A here, you see prevascular, right? These are the most anterior ones. Here we have the trachea and superior vena cava. So we are almost dealing with the lower paratracheal. On the left side are the left paratracheal, left lower paratracheal. Yes. On the right are the right lower paratracheals. I think this one you need to go through them. There is a very good article on radiology assistance, which I got these images and these illustrations from. This is a very important and very good actually article, which can help to understand these subdivisions and these classifications of mediastinal lymph nodes. So you can go through it and read it again for more understanding. This is the pulmonary trunk. This is one of the subaortic nodes. This is the prevascular, the right lower paratracheal, the left lower paratracheal. These are the para-aortic nodes. We said that they are anterior and lateral to the aortic arch, between the upper and lower margins of the aortic arch. So now we are cutting within the aortic arch. Anterior and lateral to it is the para-aortic lymph node station. And this is right lower paratracheal lymph node. The seventh station is the subcarinal. We know what is carina, right? Carina is the bifurcation of the trachea into left and right main bronchus. So caudal inferior to the carina and not associated with the lower lobe bronchi or arteries are the subcarinal lymph nodes. Because if they are associated with the lower lobe bronchi, then they are like lobar and subsegmental lymph nodes. They are not this station lymph nodes. On the right side, this station is extending caudally to the lower border of bronchus intermedius. On the left side, it extends to the upper border of the lower lobe bronchus. Let's have a look here. This is the seventh station, the subcarinal lymph nodes. This is the carina, which is the bifurcation of the trachea. So this station is extending from the carina to the lower border of the bronchus intermedius on the right and the upper border of the left lower lobe bronchus on the left side. So this is 7. If we go more peripherally, then we are dealing with the lobar and subsegmental. And if we are going more inferior within the midline, then we are dealing with the paraesophageal and other lymph nodes. So these are the subcarinal lymph nodes. Let's have this image. Here we have the right main bronchus, right? And this is the left main bronchus, which means that we are below the carina and above the lower lobes and bronchus intermedius bronchus, right? So these are the subcarinal. The 8th station is the paraesophageal. These ones are below the carinal nodes. We knew what is the inferior margin of carinal nodes, subcarinal nodes, right? So inferior to this margin and around the esophagus are the paraesophageal lymph nodes. These ones. This is the lower border of the subcarinal lymph nodes. So from here, inferiorly, around the esophagus, at the paraesophageal. We see an image here. This is the esophagus. It has this minimal air, right? Yeah. So, how we know that this is not subcarinal? Who can tell me? Why this is not subcarinal lymph node?
we don't see the bronchus.
Yeah. The main bronchi are already branching, right? Yeah. Here we can see the branches of the main bronchus. This is more down, yeah. This is below the lower margin of the subcarinal lymph nodes. So this is the paraesophageal lymph node. The second station is the pulmonary ligament nodes. The pulmonary ligament is the ninth station. The pulmonary ligament is the inferior extension of the mediastinal pleural reflections that surround the hilum. So, lying within the pulmonary ligament, including those in the posterior wall and the lower part of the inferior pulmonary vein. So we need to find the pulmonary veins, the inferior pulmonary veins. The ones that are included within the posterior and lower part of it are the pulmonary ligament nodes. These ones. On this illustration. Here, this is the pulmonary vein, right? These are the pulmonary veins. So included within the wall of the pulmonary veins are the pulmonary ligament nodes. So our main landmark here is the pulmonary vein. The 10th station is the hilar nodes. These nodes are proximal lobar nodes, distal to the mediastinal pleural reflection, and nodes adjacent to the intermediate bronchus on the right. So, 10th are the ones that are within the hilar or around the hilar of the lungs. Here, 10. These are hilar lymph nodes. So here let's review what we have learned about the mediastinal lymph nodes. The one are the supraclavicular, right? Yeah, they are divided into left and right. Then two, the upper paratracheal, yes, yeah, and then they are divided into left and right. And three are the prevascular, yeah, they are not seen here. Then four, the lower paratracheal, left and right. Fifth, aortic pulmonary window lymph nodes or the subaortic lymph nodes. 6, para-aortic lymph nodes. 7th, subcarinal, yeah. 8th, paraesophageal, yes. 9th, pulmonary ligament lymph nodes, yeah. 10th, hilar. Then 11 to 14 are the lobar, the segmental and subsegmental lymph nodes. So let's have a look to this illustration here. This is a series of axial CT image showing these annotations or highlighting the locations of each of these nodes. So one here is the supraclavicular, above the clavicle, above the sternum, right? Then here 3P is the pre-vertebral, right? We said 3 is prevascular and prevertebral, yeah. So these ones, they are anterior to the vertebral column and around the vertebral column, so they are the third station. We move down, here we see the second station, which are the upper paratracheal. On left side, the left ones, and the right side, the right ones. 3A are the prevascular, right? And these are the prevertebral. Here, perivascular, right? Then here we can see the superior vena cava, right? Yeah. So now we are in the lower paratracheal, left and right. Here, these are the para-aortic, the anterior and lateral to the aorta, to the aortic arch. Perivascular. Left lower paratracheal, right lower paratracheal, prevertebral, para-aortic. Here we can see the aortopulmonary window, right? Because now this is the ascending aorta, this is the descending aorta, and before the pulmonary trunk. Yeah. So we are within the subaortic window or the aortopulmonary window, and these are the para-aortic. Yeah, this is still within the aortopulmonary window.
We saw the pulmonary.
We saw the pulmonary, yeah, but they are still within the location between the pulmonary trunk and the aorta, yeah. So this is still a part of this window. So this is the subcranial tract, because here the bifurcation of the main bronchi started here. Then the hilar, these are the proximal main bronchi lymph nodes. Eighth, paraesophageal. Yes, paraesophageal. So, paraesophageal and the pulmonary ligament lymph nodes. So, this is all for today. Thank you very much.